So very excited to be speaking with KDA about the potential for some support for our legislative initiative. It's called the End Kidney Deaths Act. It's a 10-year pilot to provide a $50,000 refundable tax credit to every American who donates their kidney to a stranger. It would be allocated over 5 years, so $10,000 a year for 5 years. It would be a refundable tax credit, meaning that anyone, no matter if you pay federal tax or not, would be able to access the funds. Only half of Americans actually pay federal tax, and that's because they don't earn enough. And so this would be for people who pay a federal tax, a deduction in their taxes, and for people who don't pay federal taxes, it would be a check. And that's basically the legislation. We've had about 100 meetings since January 3rd. With both House and Senate offices. Pretty much across the board, all meetings have been positive, and people are really thinking that this is a great idea. We estimate that by year 10, we will have 60,000 new kidneys in the system, so on average 6,000 a year, knowing that it will slowly ramp up and then probably exceed the 6,000 by the end of the 10-year period, as well as a $14 billion tax saving, because dialysis costs $1 out of every 100 collected tax dollars. So for 550,000 Americans to get kidney dialysis, it's around a $50 billion annual cost. And this bill would really alter the landscape. Our original intention, it was created by a team of 4 non-directed donors, including Matt and me. The original intention was to provide a $100,000 refundable tax credit for all donors. But the political realities are that that would be more of a messaging bill than the bill that could actually pass. And so we shifted the bill to $50,000 for only non-directed donors. Our hope being that the bill would be extended beyond the 10 years, as well as expanded protections for all donors eventually. But this is our first step. We right now have a very willing lead sponsor on the House Ways and Means Committee. We're seeking a Democratic lead sponsor on that same committee, and we are planning on getting this legislation passed in the year 2024. We do not have support from the big organizations like the National Kidney Foundation and the American Association for Kidney Patients. We do have, however, a lot of support from donor organizations, and we're really looking to expand that, because the more organizations we have signing our community support letter, the more likely this will pass. And so having KDA's support would be invaluable for us.
Elaine, what's the hang up with those big organizations you mentioned?
They are entirely opposed to compensating donors, and they will not consider changing their minds. They believe that it is immoral or unethical. We believe that losing 12,000 people a year who were waiting impatiently on the kidney wait list, there are about 90,000 people on the wait list, losing 12,000 of them a year because they became too sick to be transplanted, and they had to be removed from the wait list, or they died directly from the wait list. We believe that that is both immoral and unethical, because there is a cure for their illness, which is a living kidney transplant. And so we believe that this is very ethical, because everyone will get the same amount. Everyone will get the $50,000. It won't depend on your income, like in other countries where they have successfully compensated donors. The amount of compensation varies. Sometimes it varies, that there's a negotiated price between recipient and donor, which I think is unethical, or it's a compensation based on your wages, and I think that's also unethical. So ours is incredibly fair, and the funds are coming from the place where the funds are being saved, and that would be the federal treasury. We already give refundable tax credits for people who buy electric vehicles. They get a $7,500 tax credit. For people who have children, for people who own homes. So we are incentivizing what we believe to be good behavior. We incentivize the purchase of solar panels and so on. This is incentivizing people to do right by the people who are at the top of the wait list, those that are most at risk of dying from the kidney shortage.
And Jeff, despite the lack of support from some of the major kidney advocacy groups in the country, the more people we talk to, the more individuals we realize support advising donors, but because of the kind of the public facing portion of the organization, it's difficult for them to express their individual preferences or desires because, for example, someone's on the NKF board. We know that some of the NKF state affiliates have gone as far as to vote, and in some cases 100% support for incentivizing or compensating living donors. But again, they're kind of hamstrung because of the national Kidney Foundation at the national level is culturally very resistant to change. And I can't give you numbers, but it's more than a couple of people, even on just the NKF board, that quietly support our efforts. And along those lines, if you go to our webpage, there's a lot of prominent transplant surgeons, transplant coordinators, other people that individually support the cause.
But the status
Not to
quo
get
is
too
very
far in the
profitable,
weeds,
you know?
but is
sorry.
like the big dialysis companies, are they lobbying against this either directly or indirectly?
I don't think that they will. I don't think it would make them look bad. They may in the back rooms, but honestly, right now we have 800,000 Americans with kidney failure. In 6 short years, we'll have 1 million Americans with kidney failure. Their profits are secure. I was saying earlier that that this is very profitable. What's going on now, the status quo is highly profitable for multiple organizations and individuals, and those people would be naturally opposed to anything that's going to shift things around. But I do not believe that the dialysis companies, based on what I know so far, will actively lobby against us. If anything, it would be the big organizations. But I am not afraid of them because in study after study, it shows that the majority of Americans support compensating kidney donors. So that's the majority of voters.
And at least NKF has told us that they would not oppose us. They're not going to come out publicly and support our efforts. They have opposed similar legislation in the past, so they do have that history, but we've been told pretty uncertain terms that they will not oppose our efforts.
Yeah, but there are many more organizations than just NKF. So, but I'm still not concerned that they're going to derail this effort because we've had such a positive response from all the nearly all the legislative offices we've spoken with. Is there anything I can add to it? I have 1,000 things I can say.
What are the, KDA is a small part of this, and I would be surprised if we didn't get on board and issue some statement or, specifically what you all discussed before. What are the next steps or the key hurdles for you all over, the next 6 to 12 months?
Yeah, so we're planning on getting this passed this year. So we have, where are we in time? We've got, what is that? 8 months left?
months.
A little more than that? Hold on, no. Whatever it is, we've got too few months left. So our hurdle right now is getting a Democratic lead on the House Ways and Means Committee. It's going through that committee. We have the Republican in place, which is important because they're the majority party in the House. Then we need to find leads on the Senate Finance Committee. So it's just, I think that once we get the bill introduced, we're going to have a lot of people coming on board as co-sponsors, and then we can really begin, trying to get the same thing done in the Senate. So it's really, our opposition is really time and also socializing the bill, because it is something that has never been introduced before. It is a new way of approaching this crisis. And so it's going to take a lot of energy and enthusiasm in order to get it to the finish line. So it would be excellent if both KDA becomes a signatory on our community support letter, as well as helps us in contacting congressional members where we need constituents on the calls.
Okay. Now, are there some states that have enacted something similar within the state?
So a lot of states have in place tax credits or tax deductions to cover cost and lost wages. Now, right now in this country, over 50% of donors are financially whole after donation, meaning that their cost and lost wages are completely covered. However, we've not had an increase in donation as a result, demonstrating that is not enough to really make a dent in the wait list. So 20% of donors are reimbursed by the federal low-income donor reimbursement program. 30% of donors are reimbursed by the National Kidney Registry. And then among individual states, there are a lot of different programs for people and other private organizations to get the cost and loss wages returned so that someone does not go into debt to donate. However, that, you know, we don't see an increase. We've had for the last 24 years, roughly 6,000 living kidney donors, even while the number of people who need kidneys has more than doubled during that time. And we've had nearly a doubling of people who need kidneys over the last 24 years. So supply is not keeping pace with demand.
Yeah.
Elaine, can you, oh, go ahead, Jeff.
No, I was just going to ask, just out of curiosity, what's the financial break even, if you will? I don't know enough about the cost of dialysis to know if, boy, you know, within 6 months, this is a cash positive to the government or, you know, payers or something like that.
Matt, you want to take that
Exactly what I was going to ask you to talk about.
one? Okay.
Yeah, Elaine gave you the kind of the whole enchilada there at the 10-year mark. But if you break it down, you know, it's quite complicated because of our insurance system in this country and every hospital billing differing amounts for surgeries and medications, et cetera, but very broad, individual, broad strokes. Transplant surgery costs maybe $125,000 or so. So that's a one-time cost up front. As Elaine had said earlier, dialysis, and dialysis is pretty consistently about $100,000 a year per patient. And then, you know, post-transplant, a recipient is going to maybe have $25,000 to $30,000 of medication costs, anti-rejection medications primarily. So when you net all that out, it's over the lifetime, and prominent economists have done this math, I haven't, over the lifetime of a recipient, the savings to society is roughly in the $400,000 to $1.4 million range. And the primary reason why that's such a huge range is it really is very dependent on what that particular individual does for a living and how old they are. So if they're, you know, a high earner and they're young, it's going to be much closer to the 1.4 million. And, you know, the opposite, of course, is the case. And every case is different, but it's, as we like to say on all these legislative calls, there aren't many legislative proposals that both save lives and save money, right? Usually you've got to spend some money to get a better outcome, either longer life or healthier life. But in this case, you're saving money and literally saving lives every time you transplant one person.
Yeah, great. Thank you.
Does the refundable tax credit make sense to you both? It's often misunderstood or confusing to folks. That's why I ask, you know, in all our calls that comes up often.
Well, I'll ask, I think I understand it. So if I, as a taxpayer, owe, just make up a number, $5,000 in federal income tax this year, it would be offset dollar for dollar by this legislation, correct?
Right. So $5,000 owed is a great number to use, because not only would your $5,000 tax bill be erased, but you'd also get a $5,000 check.
Right.
So you're right in the middle of the slope, right? If you owe more than $10,000, you'll get a $10,000 reduction in your tax bill. If you're, you know, zero owing federal taxes, then you get a check for $10,000, and then everyone's in between those two extremes. So the important facts there are, one, everyone benefits. I think there's a a bias that tax breaks are only for the wealthy. And number two, it's progressive in that, the $10,000 a year is much more valuable to a low income earner, say at 30,000, than at a higher income earner at 300,000. So, and it's the same amount. Or, we can talk about other forms of, not really healthcare, but at least buying or paying for health related resources that are, human tissue or blood. Surrogate pregnancy is the one that we often allude to, and that's a private market. So people negotiate what they pay for that, and it can be upwards of $60,000 to $80,000 for a single pregnancy. And of course, we pay people for plasma, in some places blood, bone marrow. So it's not unheard of. The counterpoint is that all of those are renewable, quote unquote. But yes, that's we've kind of come to this kind of middle ground, so to speak. There's some prominent economists that think we should pay folks more money and all of it up front. There are others that feel it's too much. There are some that want, let's just give people Medicare, let's give them retirement account money. But at the end of the day, the beauty of our proposal is people can do with it what they so choose. If you're adamantly opposed to being compensated, then don't file for the credit on your tax return, or give it to your favorite charity. Or if you have young children, you want 529 money, put it there. So as Elaine has said many times, we're trusting people to use their best judgment and to use the compensation in whatever means they see fit.
Which is exactly what we do with any other compensation given by the government to people who do things that the government wants them to do.
Precisely, yeah. Very well said, Matt. I also want to add that low-income people are 4 times less likely to be transplanted, 4 times more likely to be on dialysis. And as we know, wealthy people can put up billboards, can hire a team of people to find a kidney for them, can go abroad and get a black market kidney. They have choices, and they get themselves more often than not cared for in the system.
Right.
Whereas low-income people are more likely to languish on dialysis and die from the kidney shortage. So one thing that I heard that's very moving is that people on dialysis, which is 3 times a week, 4 hours a day, begin dialysis by walking into the clinic. Then they need to be wheelchaired in, and then they come in on a gurney. Earlier today, I was in a meeting with a mother who donated a kidney for her son. And one day she picked him up from dialysis, and it's a horrible story to repeat, but a woman had died next to him while he was on dialysis. So it really is very rough, and half of people who begin dialysis die within the first 5 years. So anyone who's had experience with dialysis knows it's a living death of sorts. It keeps people alive, but not living. So we just want to get kidneys to as many people as we possibly can.
Yeah. Last question, again, curiosity. And I know tax systems are different around the world. Are there any other, let's say, first world countries who have something somewhat like this?
So we have right now 4 countries that incentivize donation, but they don't do it in this fashion.
Okay.
And so Iran, the state provides a small amount, and then there's a negotiated price with the recipient. Again, unethical, different amounts for different people, but they're the only country in the world with no wait list. Then we have Israel and Saudi Arabia and the Netherlands. They do the compensation based on your wage. So if you're a high wage earner, you're going to get 40 days of, let's say, lost wages, whether or not you needed it. You're going to get that from the government. So it's uneven. If you don't work, you're not going to get anything. So again, not very ethical. Ours would be the only one in the world that's uniform and I believe very fair. The definition of exploitation, by the way, is getting different amounts of money for the same good or getting no money for that good. So our bill is the opposite of exploitation, in my opinion.
Right.
Elaine, are there any major opposing viewpoints that you have come against multiple times that you have that you can bring up and then give a counterpoint to?
It's just that exactly what we're asked frequently on calls, is this ethical? Is this moral? And
Mm.
so I answer with, defining what ethical is, and explaining that this is highly ethical, and it's not ethical to do nothing while so many people die. And dying from kidney failure is a horrendous way to go. So I think it's unethical it's like denying people a life-saving heart medication. We wouldn't have people putting up billboards or wearing sandwich boards to get the heart medication, but that's essentially what they need to do in order to get a kidney. And there are so many people. Oh, also, one thing that's really important to know about the kidney shortage is it's getting worse because Americans are getting less and less healthy. So fewer and fewer people are able to qualify to donate. So my example that really demonstrates this is the Collins family. They're a Gold Star family. Their son was killed in Iraq on active duty. Their daughter's dying from the kidney shortage. They're trying desperately to get her a living kidney donor. 23 people have come forward to donate to her, and not one of them was healthy enough to pass the transplant center's very high standards. So as we're getting fewer and fewer Americans who will be healthy enough to donate, we now have 140 Americans who are either diabetic or pre-diabetic, very unlikely to pass transplant center screening. We're having, and that's more than half of American adults, right? So they estimate that only a third of American adults would be healthy enough. And then after that, you just, eliminate people who wouldn't want to do it in the first place, even if millions of dollars were offered, and so we just have a very small pool of people to draw from. I think that emphasizes the need to incentivize.
I think a related point that we hear often is that it will adversely affect the poor, and that, the counterpoints to that are, one, that's the biggest group that we stand to help the most. Most of their, they generally have smaller social circles. Those in that circle are usually, they're more likely to be unhealthy. Therefore, they need, to expand their pool of potential donors. And secondly, we structure this so it's not a lottery. So you're not getting a check as you're wheeled out the door from your transplant surgery. It's spread over 5 years. It's tax return based. So, even if you donated mid-year in a calendar year, you still won't see the first $10,000 until the following March. And then, every year thereafter. So I don't think it's, we're trying to avoid the impression of this being, a lottery system. I just don't, and plus, as you all know, the evaluation process is months long, 6 or more. So it's not like someone's walking in and donating blood, for example, on very, very short notice and just buzzing through the qualifying questions. And transplant centers are very rigorous, both medically and behavioral, mental health wise. So I doubt that their screening would need to change much. Some people would argue they're too rigorous, but that's a conversation for another day.
I have a follow-up question based on, because I've kind of been following along from, a point in time when this legislation looked a little different than it currently does. If the incentivization is for people who are donating altruistically, my main question was, because I was thinking about how the people who are benefiting obviously are the people who are receiving the kidneys, but people who want to donate and who have the barrier of their inability to, navigate the financial hurdles involved with donation, they also will benefit because they'll be able to donate. I was thinking it would be helpful for them if they want to donate to a friend. For example, if you have a poor recipient and you have a potentially poor donor who wants to donate to that recipient but can't because they can't take that time off work or whatever, and the programs in place aren't enough to help them navigate that. But with the legislation as it's currently written, they wouldn't necessarily be able to do a directed donation. Does this legislation allow for the kind of voucher program situation where you donate through NKR to a stranger and you would qualify at that point, but then you would have the voucher to give to your intended recipient?
So it wouldn't be for someone who is getting a standard voucher. So someone who's getting a family voucher. But for the low-income donor with a low-income recipient, they would be able to access funds from the low-income donor reimbursement system that the federal government offers. And that's a $6,000, up to a $6,000 reimbursement for lost wages and out-of-pocket costs that are in real time. So you get a credit card and that it can pay for your
Through
flight if
Nelnet.
needed. And yeah, exactly. Pay for your
Got
hotel. And so that person would not need to necessarily incur any expenses because of the NowDebt program.
Gotcha. I wasn't sure if this specific legislation applied to that circumstance.
Yeah, we're really aiming to help the people who are at the top of the wait list. So not the people who are showing up on the news programs or, you know, on Facebook and people, in essence, they're cutting the line, right? And I support them cutting the line because it's a deadly line. If you wait too long, you're not going to be on the line anymore. However,
Right.
the people who are at the top of the wait list are the people who've been there the longest. They're the most likely to die. They're the ones who are more likely to be poor, more likely to have no one around them to donate on their behalf. Or they wouldn't be on the wait list to begin with. And so those are the people who are going to benefit the most. But adding 6,000 to the pool will really help those who are the most likely to be pulled off the wait list because they became too sick.
And we struggled with that very question, Emily, and went back and forth about, you know, parent exchanges and, you know, definition of
Ultimately,
a right
if that
definition of a
compromise gets the
stranger. I mean,
thing,
it really got down to
if that
who's a
compromise is what gets
stranger.
legislation passed, then, you know, it's a good compromise to make, and then it can be
Yeah.
expounded upon later. But yeah,
Yeah,
get
I
it.
mean, if we had what we wanted, it would be for all donors and it would be far more than 50, right? So we started out with 100 for all. But yeah, we need to thread the needle. We need to get this to the finish line. And the idea of saving so many lives is incredible. And hopefully it will set the stage for expansion.
Aside from signing on, in the event that the board votes that that's a thing that we want to do, in what ways can kidney donor athletes be supportive of this initiative? If we decide this is something we want to kind of take on as a cause for the organization.
To really help us with a congressional meeting. So for example, once the bill's introduced, we're going to have a lobbying day. People want to come to that. If people want to, we meet every month on Tuesdays at 5 o'clock Eastern. To discuss, you know, our movement and to get feedback. I think that in any way that members want to get involved, either through showing up to meetings that are always over Zoom, or you know, just spreading the word so we can get more supporters is incredibly important for the movement. But yeah, just you know, if individuals want to get involved, but certainly having the signature of KDA on our community letter, both would be amazingly helpful.
Yes, because there are some states that we lack constituents in, and almost without exception, when we have these legislative office meetings, they want to hear from constituents. And we've even had some folks on the calls, right, Elaine, that weren't even necessarily a recipient or a donor.
Right.
You know, they were somehow affiliated. Maybe it was a friend, or they worked in a lab that processed, you know, kidney biopsy samples, for example. So those connections are very important for the handful of states that we kind of struck out being able to reach out to.
Yeah.
Awesome. Well, this has been tremendously helpful. I feel like we've got a pretty decent grip on what you guys are trying to get accomplished and how we can help. Is there any final things that you guys want to share and make sure that the board hears before we talk about it and make a decision?
I think it's very important to understand that we have until the end of December. And this is an election year. Last year, there was record low legislation passed. Not since the Great Depression has that little amount of legislation passed. And this is, again, another year where we're not having a lot of legislation passed. So the odds are against us. However, I do strongly believe that politicians are going to want to show their voters that they've done something. And this is something that I think has something for everyone, you know, saving lives and saving money. But this is not a movement like most people, when they start these kind of movements, they have a 10-year plan. We have a 1-year plan. We're getting this done this year, and we really need to come together because people on dialysis are too exhausted to take part in this movement. So as donors, we're energetic, we're healthy, we know how transformative donation is. So I think getting behind this now is really essential, and we really need to get to the finish line. And so when donors come together right now, it's only donor organizations signing on to our bill. We are, I think, the healthy insiders who can speak for dialysis patients. And so I just implore you to get on board and apply energy to getting this to the finish line. And I look forward to the
Elaine,
signing ceremony.
have we provided any materials for reference?
That's
to
a
the
great thing.
board?
So yeah, Emily, I'll follow up with you with the bill summary as well as legislative language. An article that demonstrates that the majority of Americans support compensation, one that shows that a $50,000 incentive would incentivize far more people to step forward, and a cost benefit analysis of the bill, as well as talking points. So I'll just throw all of that into your inbox, and please share it with the board. But yeah, I feel like, you know, I think it's a bill it's very hard to say no to, but I think that the political leaders need to understand that this is broadly supported, and certainly having KDA on our team would be incredibly valuable in communicating that.
Wonderful.
Great.
I really appreciate you guys taking the time. Go ahead, Jeff.
No, I was just gonna say, did you reference a website? Do you all have a website, or is there a?
Yes, we do. Yeah, so it's modifynota.org or the endkidneydeaths.org or .com. And actually, one way that people can really help us is to sign our mission statement. When you do that, then I have access to your zip code and state, and I can start communicating with you about going to congressional meetings. Emily, you've been in congressional meetings, so you know what it's all about. It's painless, but if you don't want to show up, you can write a statement that can be shared with the staffer. But really, we just need the constituents to help us get the meetings oftentimes.
Great, thank you.
Sure. So I'll share that as well with you, Emily.
Perfect. Awesome. This has been great. I really appreciate your time. Elaine, thank you for recording it. Please send that my way as well. I'll make sure it gets in front of the right people.
Great.
I think that's it.
Yeah, we
Super.
appreciate your all's time as well.